In a matter of months, Oklahoma's only health care program for the working poor will end. Some state government leaders blame the federal government, but the legislature was unable to agree on a state fix for the Insure Oklahoma program or implementation of the Affordable Care Act. With health care needs increasing, fear and uncertainty are rising for hundreds of thousands of Oklahomans.
The tornadoes that killed 26 people and injured nearly 400 others is re-emphasizing the fact that more than 600,000 Oklahomans have no health care insurance. The trends show that between 20 and 30% of those injured in the May 19th and 20th tornadoes had no health care insurance. Craig Jones is president of the Oklahoma Hospital Association.
And meanwhile, you've got people just where we started out that go through a disaster like we've gone through in the last week and a half, and they're left out in the cold. And here we are looking around forming special accounts to help cover for their needs.
At the OU Medical Center and Children's Hospital, 93 patients were admitted. 20 had to be admitted for extended treatment. Dr. Roxy Albrecht, the trauma medical director at OU Medical Center, describes the most severe of those injuries.
What we called the gloving injuries, which is the separation of tissue from other tissues, open wounds, impalements, fractures, open fractures, broken extremities.
It took every resource available to deal with the rush of injured. Dr. Bob Letton is the pediatric trauma medical director at Children's Hospital.
A team of people who comprised neonatologists, pulmonologists, gastroenterologists, cardiologists. Every physician in the hospital was down there. Every resident in the hospital was down there.
A scene that was repeated at 3 other hospitals. In Oklahoma City, everything to deal with such emergencies is readily available. That is not the case statewide. Because the state has rejected involvement in the Affordable Health Care Act, the Hospital Association's Craig Jones says the health care safety net will get smaller.
We clearly are going to have some hospitals, as we've talked before, that just aren't going to be able to make it. Yeah. Because you can't incur some of the things that they're incurring and then be the safety net for something like this that happens.
The first signs of those changes come from Tulsa. The St. John Health System says it is facing a challenging economic reality created by Oklahoma's decision not to participate in Medicaid expansion. A reality, it says, will cost $20 million a year in reduced Medicaid reimbursements and another $15 million in reimbursements and Medicare payments, plus the impact of federal sequestration cuts. Individual Oklahomans are now facing similar health care decisions. The Insure Oklahoma plan provided coverage for nearly 30,000 people who work but don't make enough money to buy health care insurance on their own. That program will end December 31st.
It's been a real strong point for us as far as attracting quality employees, which is tough in our business because we're competing with, I'm trying to get the same guys that Aubrey McClendon's trying to get, or Chesapeake, or these type of companies.
Charlie English owns a tree service, a company that's been around for decades, but found it financially difficult to offer employees health care coverage until Insure Oklahoma.
Most of them are parents, and so they have families and wives that take care of the children, so they have a need for insurance.
Without Insure Oklahoma, English has no idea if his workers will qualify for the new health care exchange, and he doubts they will qualify for Medicaid.
We're all nervous about it. We're speculating as to what will happen, and we're kind of at the mercy of the system, and hope we get some relief.
A situation that also impacts small professional companies like the Branch and Hurt Law Firm in Oklahoma City. John Branch is worried about his workers.
They'll probably simply have to go without health insurance. So if they have to have emergency care, the taxpayers get to pay for it.
And Branch believes all the uncertainty could have been avoided.
I just don't understand the logic, if any there was, as to why we're not a part of the federal program.
LaChrista Bagley works for the law firm, and her health care insurance comes from Insure Oklahoma. She had no idea the program would soon be over.
Actually, I just found out right before I came back here. So I was like, wow, I understand that was the great thing of opting out of our government plan.
Bagley is just one of those Oklahomans who is now facing some new choices.
You either stay with the job that you love and you've been at we're a family here. You know, we take care of each other. The only other option I have is to go corporate and go downtown.
At the St. John's Missionary Baptist Church and Christian Heritage Academy, 5 workers are covered by Insure Oklahoma, a program that business manager Anthony Jackson says was a win-win for the church and its employees. But without it, everyone loses.
Our expenses increase and our liabilities increase, as well as the employees' expenses will increase because some of these people have numerous children that have to have insurance.
Anthony says confusion and uncertainty is spreading through the workplace because of decisions made by state leaders.
Some people will qualify, some people won't. But what happened to those 10,000? Maybe all of our employees will fall on that 10,000. Maybe they'll fall on that 30,000. Who knows? But that's the uncertainty that puzzles me and scares me, actually.
The 10,000 number Jackson refers to is the estimated number of people who are on the Insure Oklahoma plan, but when it ends, will not qualify to join the healthcare exchange because they don't make enough money, and won't qualify for the Medicaid program because they make too much money. Even though Insure Oklahoma does not mesh with the new federal law, federal officials offered to work with the state to find solutions.
And they gave indications that they would be willing to work with the state. It's a two-way process. And I just haven't heard that the right people at the state so far are willing. I think it continues to be leveraged from an ideological standpoint.
A plan put forward by a pair of state lawmakers to keep Insure Oklahoma going never got off the ground in the legislature. The governor then offered a plan using $50 million from the tobacco fund to keep the program alive for the 10,000 left in limbo. But House Speaker T.W. Shannon shot that proposal down, saying, quote, "Government has no place having its hands in people's health care choices."
Everything's topsy-turvy, and that's not a good thing. The state of uncertainty is not a good thing.
And if I can't offer health benefits, it's hard for me to compete.
But we're sort of in never land right now.
The decision that Oklahoma has been making so far is we're discriminating against a group of individuals that otherwise would have health care, that because of the position the state's taking.
Jones hopes a report the state paid for to tell it how to deal with this situation has some answers that will change leaders' minds and make compromise and movement on health care insurance in Oklahoma possible. That report is due in a few weeks.